So if you've been dealing with neck or back pain and you've been told surgery is the only option, that's not true. Here we specialize in spinal decompression using the DRX 9000. It's a great alternative to surgery. We're able to help a lot of people, and we're able to save a lot of people from going under the knife and having surgery. So spinal decompression is a machine that we use to help stretch out the disc. So we can do it on the cervical spine, the neck, or the lumbar spine, which is the lower back. It's a machine that uses a gentle force to gradually traction the disc apart. That will help create a vacuum effect so it pulls hydration back into the disc. It also, if you have any of the inside of the disc that's oozing out, it helps to pull that material back into where it's supposed to be. So when we put a patient on the DRX 9000, it pulls the disc apart. That creates that negative pressure, that vacuum effect that's so effective. When it's pulling, it pulls hydration back into the disc. If there's a disc herniation where you have some of the nucleus, the inside of the disc oozing out, it helps to pull that material back into where it's supposed to be. So spinal decompression is used for people that have herniated discs up in the neck that can be causing radicular pain or pain that radiates down the arms. It can also be used on somebody that has a lower back condition that maybe creates sciatica or lower back pain. There's going to be a few instances where we can't do decompression. So a pregnant patient, somebody who has a different type of bone cancer. It's also contraindicated when people have severe osteoporosis. And then there's a few other conditions, but it's very effective. We've used it on children. We've used it on patients all the way up into their 90s. So the decompression therapy that we do here is very effective. There have been times where I've recommended it for a patient and they've gotten no change out of it. But most times people do very well. Most patients are going to feel change within the first few visits. Every now and then it takes somebody, around 10 visits before they start to feel change. It all depends too on the stage of degeneration, the age of the patient, and then overall shape of the patient. Are they out of shape? Are they severely obese? So there's different factors that come into play when we evaluate a patient. So if you've been injured at work, if you've had a car accident, if you're struggling with neck pain, pain that goes down the arms, lower back pain, sciatica, and you're interested in coming in to be evaluated, give our office a call. At the bottom of this video, we have our number. We run specials, but whenever somebody comes in, we do a consultation, we take a full set of x-rays, and we do a first treatment on the first date of service. So give our office a call. So back pain is the number one reason that people miss work, they stop working out, or they get unnecessary surgery. But most people don't even know why they're actually in pain. So let's break down what's really happening in your spine and what we can do to fix it. So some of the most common causes of back pain are the most simplest movements. I have a lot of people that come in that throw their back out, tying their shoe, bending over to tie their shoe, bending over to pick the dog up or pet the dog. We have some people that roll over in bed and throw their back out. So it's not always lifting something really heavy at the gym or moving something heavy in the garage. It's usually those little movements that cause the pain or cause you to throw your back out. So I think the most common thing that people do is when they hurt their back is they think, okay, if I leave it alone, it's gonna go away. So a lot of people will give it a week, a month, and then pretty soon the pain's gotten so bad that they can't, they can barely do anything. A lot of people also throw heat on it right away. Heat feels great, but the problem with heat is it brings more inflammation to the area and can make your pain even worse. So that's another common thing that people do that they shouldn't when they first throw their back out. When somebody throws their back out, probably the best thing they can do is get ice on it right away, try and get off their feet. And it really depends on what you did. If you pinched a nerve, you want to ice the area. If you compressed a disc causing a herniation, then it's going to take a little bit more than an ice pack to make your back feel better. But I always recommend get into our office, get into another chiropractor, get an evaluation, get some x-rays, see what's going on with the problem and see what can be done to help fix it. So our office is going to be a little bit different than most chiropractic offices. We just have more tools in the toolbox. So for example, we offer chiropractic care. We do spinal decompression. We offer a lot of different modalities here, Shockwave being one of them. We do different types of injections on the medical side of the practice. So trigger point injections, regenerative joint injections. We do PRP. We do Wharton's jelly. We have different things like electric muscle stim, ice and heat, different exercises, different types of rehab that are all great when using combination to deal with different types of back pain or different types of disc herniations and things like that. The best way to prevent lower back pain, I mean, there's lots of things you can do, and it's hard to say what one thing is going to help prevent you from having back pain, but having a strong core, I always recommend to people, once we get your back pain at a point where you're not hurting too bad, let's start focusing on core strengthening exercises, hitting the abdominals, hitting the obliques, the side muscles, hitting the lower back muscles. And what that does, it helps to build up stability around the spine so you don't throw your back out over and over. It's not going to make you invincible or, you know, to where you're, you know, you're not going to ever throw your back out, but it will help significantly. All right, so we're going to start by getting you harnessed up. Okay, that looks good. And then this harness, we're going to put this over your shoulder. And I'm going to have you re-Velcro this in the front. There you go, perfect. All right, so that's the initial setup. Okay. So then we'll come over here. Okay, so I'm going to bring the table up. Come on over. I'm going to have you stand on this platform right here. You're going to lean back and then put your arms over these two pegs right here. Okay, and then we're going to tilt you down. Bend your knees for me. I'm going to put this pillow under your legs. Go a little higher for me. Go a little bit more. There we go. Okay. I'm going to undo this one. We're going to tighten these two straps right here. So just relax. There we go. This harness, what I'm going to have you do is take a deep breath in and exhale. Good. Okay. Can you still breathe okay? Okay. This last one is going to go up here. We're going to tighten this and ratchet it in. That's going to pull all the slack out. So you're going to start to slide a little bit. Good. Okay, lift your head. Good. Go ahead and relax. Okay, so I'm raising a little lumbar support underneath. That's going to put a little bit of an arch in your back. We're going to move the bed this direction. So next we're going to program in the weight we're going to use. So we're going to start you at 85 pounds of pressure. Okay, so you're going to feel this start to tighten and it's going to start pulling very gradually. If you look up here, this is your time. So you're on the machine for 28.2 minutes. This is your current load. So you're going to see this number starting to come up until it gets to 85. So you're at 78 pounds of pressure. It's going to go to 85. Now when we do this treatment, we always start everybody at 85 pounds of pressure. It's not a whole lot. Some people do really well with it. Some people it's too much. And then some people feel like, man, I don't feel any pull at all. Can you feel it pulling? A little bit. A little bit? Okay. So what we have found is it's better to do the first treatment at a light weight and then gradually increase. If we start off too heavy from the get-go, some people, it makes them worse right off the bat and they walk out, you know, in more pain or kind of bent forward. So based on how you respond to this treatment, we'll determine how much we raise it next treatment, or if we leave it alone, or do nothing. So you're on for about 27 more minutes. So I encourage you to try and relax, try and fall asleep, or just completely relax your lower back. You'll feel pressure. So right now it's on the down cycle. So it's down to 47 pounds of pressure. So it ramps up to the full, 85 pounds, 95 pounds, and then it holds you there for about 30 seconds and then it drops down half the weight. So that's where we get the pumping. It pulls, relaxes, pulls, relaxes. So the unlock feature, it lets the bottom half of the table slide independently. So without it, I guess there's friction that doesn't allow you to pull. The machine will also, it has a line down here that shows how much tension the machine has on it. So if you're like spasming or tightening up, it'll track that. It'll have little spikes in how the patient's resisting to the treatment. Yeah, normally we'll, you know, walk away so you're just relaxing on the table. You don't have somebody hovering over you. So when a patient's finished with the treatment, we'll come back over. We'll usually start by opening this one. So it's kind of like a breath of fresh air because you got a lot of pressure on the abdomen. Then we'll loosen these up a little bit. So we're gonna lock the bed. I'm gonna have you lift your legs. I'm gonna take this back out. Got that done. Okay, let me take this back out. Okay. Okay. Go ahead and come back off the machine. And then come over here, we're gonna take the harness back off. So what we'll do, I'm gonna disconnect this side. We're gonna let it fall to the ground and then just step that. Yep, perfect. So if you're having back pain, sciatica, if you suffer from a disc herniation, give our office a call. The number's 209-838-3434. We'd love to have the opportunity to help you.